Hey guys, want to make a little follow-up video to last week's video with myself and Dr. Gina from Roscoe Physical Therapy, because we talked about knee pain. And a lot of times if you have knee pain, a very common knee pain is patella tendonitis. So that tendon that runs through and comes really right down. A lot of times people get hot right underneath the kneecap. So that that right there is the patella tendon. But in talking with Dr. Gina last week, it's typically not the patella tendon's fault that it's sore. Okay, typically that problem is either downstream or upstream, taking a Kelly Starrett line there. So just some things that you can do. Now, a couple thoughts. One is, I am not a doctor nor a physical therapist, nor do I play one on YouTube. But what we do know is that if you take care of the tissues that are below that area and above that area, a lot of times that will make that whole knee area feel much better. So the first thing here is that you can take a foam roller, or we really just like the PVC roller. It's a little bit more aggressive if you can handle it. But we really want to, it's really typical for people to be really tight in the quads. So if we attack those quads just by rolling on the foam roller or the PVC pipe, and you can be pretty aggressive with this. We don't want it to be so painful that you cry, because crying makes me uncomfortable. I'm going to be honest with you. But you can really attack that, and where I get tight, because I do some running, where I get tight is my IT band. Okay, gets really, really tacked down. And so what feels good to me often is by hammering the heck out of this thing, and really the bottom of the IT band right above the knee, all the way up as it inserts, kind of runs through the hip. Yeah! So that feels a little funny. And if it feels a little funny, it's probably because it's a little funny. And we don't want it to be funny. Healthy tissue doesn't hurt. Dehydrated tissue, tacked down tissue, okay, not healthy tissue, does hurt, like when you press on it. So like this shouldn't hurt, but it does, okay? I'm probably a little tight. So by rolling on this and getting, again, really the entire quad, the middle of the quad, the outside of the quad, or the outside of the quad, the inside of the quad, like just smashing all of this, okay, can really help kind of release some of the pain that a lot of times gets locked up within the patella tendon. If you go downstream, okay, you can attack your calves in a similar way. Okay, and we're able to hit the outside of the calf, we're able to hit the inside of the calf, we're able to hit the middle of the calf, and when I do this, I get really tight at the top, really top right outside, right in here. I feel like, man, that's a little uncomfortable right there. So, I can throw a leg over if it's not enough. And again, I'm not crying here, but it is a little uncomfortable. Okay? Okay, if you have a super friend, they can come and press, right on the calf to, create a little bit more distraction and that old thing. Oh my gosh, that's fantastic. Okay. But we're looking to loosen up everything. So here's the problem. We're looking to loosen everything up, below the calf and above. I'm sorry, below the knee, below the patella tendon, and above the patella tendon. Okay, and what we find is that you can take care of a lot of this business yourself. Okay, again, I'm not a physical therapist, but if you're able to loosen up your quads, loosen up the IT band, loosen up the calves, okay, it might help knee pain. Okay, again, not a doctor. You should consult your doctor. But a lot of good things can happen with this, with just you and your own PVC pipe or foam roller. Thanks for watching.
Not doctor, not TV.